Maybe he landed here totally by coincidence. But if by chance he's admiring your fresh coat of Benjamin Moore soft sky blue, well, that's a pretty high compliment. Coming from an expert.
Quality products and installation since 1985. That's Four Seasons.
Welcome everybody. I'm so glad to be here today at Hemlock Pain Center. They've been here in town, but we got this beautiful new complex you're looking at right now. But I have with me Dr. Tafor and also Dr. Datta. What made y'all, you already been in Dublin, but Dr. Datta, what made y'all invest in a facility like this?
Well, we had been, as you said, we've been in town for quite some time, and we were accepting more and more patients, and we frankly just outgrew the facility. And we wanted another facility where the patients would feel more comfortable, that was more up to date, and essentially that was the main reason we built right across the street from where we were before.
Well, you succeeded at it, I'll tell you that, because this place is gorgeous. I was telling your wife a minute ago, just state-of-the-art facility right here. No, you said something a little while ago when we were talking about driving. You know, when you're in a lot of pain, I say this about cancer patients and people in chronic pain, traveling to Vidalia or Macon or Milledgeville or whatever, it can wear on you. So talk about that a minute.
Well, that is so true. We like I said earlier, we have some patients who used to travel all the way to Macon, to receive care, and we were happy to get them there and take care of them. But you could tell their demeanor sometimes after a long travel, dealing with chronic pain for an extended period of time. It really wears on their psyche as well. So we wanted to bring the care to them and also make them feel much more comfortable around the environment where they were being taken care of. And so it was the genius of Dr. Datta. He said, we need to get a permanent location in Dublin, and here we are.
Yeah, absolutely. You said something a minute ago. Veterans are near and dear to my heart, and we're so fortunate to have the VA hospital here. Not only do they serve 52 counties, but they employ about 1,800 people, which is great for the community. But you mentioned veterans a while ago, and I know it's near and dear to both of your hearts, too. Talk about that a minute.
Well, we feel very strongly about caring for our veterans. They served for the country. They put their lives on the line, and when they come back, they're not always in the same shape that they left. So many of these veterans, sometimes we see them immediately after their duty. Sometimes it's 20, 30 years later, when all the grueling wear and tear of the military service takes a toll. Sometimes it takes a toll immediately when they're 30. Sometimes it may not take effect until their joints, different body parts are worn out a few years later. So when we see the vets, we're just absolutely grateful to return, the service that they have given to us. Amen. All this time.
Amen.
Yeah, and if I may add to that, I would love to say, sometimes healthcare provision is, can be a thankless job. But that is not the case when we treat veterans. I mean, they are some of the most appreciative from our patients, and it feels so gratifying to see that even though we feel indebted to them for the service to the nation, they feel lucky to be able to obtain private care in an environment that is caring and truly respectful of what they've provided for the country. So we're grateful for that opportunity to be able to help our veterans.
Oh, absolutely. And if you're watching us now, you are a veteran and you've been in chronic pain. The number's right there on the bottom of the screen. We got it there for you. We'll talk just a few more minutes. You can get a pen, write down the number, call, make an appointment. Come in and just do a consultation. There's more than one way, Dr. Datta, that you treat people. If it takes medicine, if it takes injections maybe in the back or hip or whatever, there's not just a one-way thing to do it, is there?
No, of course not. So every patient, every veteran, everyone we see receives individualized care. Not everybody is built the same way. Not everybody's going to be hurting for the same reason. So it requires us to carefully sit down with them, and we sit down with every one of our patients, especially in the beginning when they come in. They see a doctor. They don't just see one of the nurses. Everybody gets to see a doctor when you come in, and we spend time with a full evaluation with them, and we decide on their individualized care plan.
Yep. Now that's incredible, y'all, because a lot of places you go, you see a physician's assistant or nurse or whatever, but when you come in, you're going to see a doctor, somebody that can sit down with you and figure out how to handle a particular problem you got. Dr. Tafor, how does it feel personally? I just got to know, listening to y'all talk earlier and talking right now, on a personal level, how does it make you feel when you help somebody with that chronic pain and you see them finally getting some comfort?
That is such a good question. It's a gratifying feeling, and part of the reason is because we don't just treat pain, we treat the individual. When the patient comes to us, having dealt with chronic pain for some people is 6 months, for some people, like Dr. Datta said, is 30 years. Having dealt with that for that extended amount of time, they become a psychological component to that pain that in itself is painful. So if you get to sit down and listen to that patient, tell you what they've been through, tell you where they're hurting, tell you their aches, sometimes just the aspect of sitting and listening to their conversation provides some degree of healing. This is somewhere where we can actually communicate about what is going on. And at the end of the day, when they have pain relief, it is gratifying, not just to them, to us as well. We feel, we go home with smiles on our faces that we've been able to make a dent in reducing pain in their lives. So that is a good feeling.
I keep hearing something from both of you. I keep thinking psychological and listen to what you're saying. Dr. Datta, what I hear is, if you don't watch out, pain and depression can be friends. Do you agree with that?
Absolutely. So pain and psychological and emotional aspects, they intertwine. Definitely. There's absolutely no doubt about it. We can certainly treat one part of it. That's why frequently we recommend that they maintain with their therapist, whether it's at the VA or somewhere outside in a private facility, because pain can exacerbate your underlying psychological conditions, and it works vice versa. Any psychological condition can exacerbate your pain, and it's not always to sort of separate the two, but we try our best to do that, and frequently you have to end up treating both conditions, so we rely on our partner physicians to help manage the other aspects of it.
It's teamwork.
Of course.
Teamwork.
It's team, not only y'all, but their physician.
Correct.
So before we go, Dr. Tafor, is anything you'd like to add?
Well, I just want to be able to let the folks in the community here in Dublin know that we're here for them. If we can be of assistance to them, please give us a call, and we'll be able to help you the best we can.
Okay. Dr. Datta, you'd like to add something?
We are here to serve the community, and basically that's it.
Okay. Man, a few words, but it means a lot. The number's been there on the screen. Please, and I'm telling you, it's a great facility, great doctors. They genuinely care about you. So call the number on the bottom of the screen. They'll be glad to bring you in. And I think the best thing I heard today, above everything else, they do care about you and that you will see a doctor. That's so important this day and time. So call Hemlock Pain Center right there on the screen. Thank you for joining us. The City of Dublin Natural Gas provides the most cost-efficient source of energy available today. So for your home, choose the most natural resource. Safe, clean, efficient. All new subdivisions around the Dublin area have natural gas available. Start reducing your energy bills today with Dublin City Natural Gas Department. Natural gas, the smart choice. Call 277-5048 today and let us help you start saving today.